Potential role of alveolar macrophages in tumor regression.
Alveolar macrophages are a type of immune cell found in the alveoli of the lungs. It's responsible for phagocytosis, a process in which they engulf and digest foreign particles, such as bacteria, viruses, and debris. By clearing these particles from the respiratory surfaces, alveolar macrophages help protect the lungs from infections and maintain respiratory health. Alveolar macrophages can be categorized into two different types, which is classically activated macrophages, M1, and alternatively activated macrophages, M2. M1 is activated by interferon gamma, IFN, with or without lipopolysaccharide, LPS, and tumor necrosis factor, TNF, while M2, associated with tumor initiation and progression, and has also been described as an inhibitor of inflammatory responses.
Tumour necrosis alpha, produced by activated macrophages. It is responsible for a diverse range of signaling events within cells, leading to necrosis or apoptosis. It's also suppressed tumor cell proliferation and induced tumor regression. Next, interleukin-6 regulate the immune response and inflammation in the body. IL-6 increase in lung patient cancer in response of LPS stimulation. However, there is also a study mentioned that IL-6 promote lung tumor growth and its association with poor prognosis. Lastly, interleukin-1. IL-1 mediates cytotoxicity and suppression of tumor growth. Activate T cells, promote inflammation and tissue repair.
It has been demonstrated that alveolar macrophage produced from lung cancer patients effectively inhibit the growth of tumor in vitro. Compared to individuals with non-malignant diseases, people with lung cancer have been shown to have increased tumor necrosis factor alpha and interleukin-1. These two types of cytokines was released by the alveolar macrophage upon stimulation with interferon, gamma and granulocyte macrophage, colony-stimulating factor, GM-CSF. So for interleukin-1, it mediates cytotoxicity and suppression of tumor growth. While for tumor necrosis factor alpha, it suppresses angiogenesis in order to stop the growth of tumors. Therefore, tumor necrosis factor alpha can act as an anti-tumor monokine and be in charge of the cytotoxic effects of alveolar macrophage that occur spontaneously. Hence, alveolar macrophage from patients with lung cancer may be able to secrete normal amounts of pro-inflammatory cytokines, which indicate that alveolar macrophage in lung cancer patients are functioning regularly. Notwithstanding these results, patients with lung cancer have also been found to have reduced tumor necrosis factor alpha. However, Lynch et al. Showed that the reduction of this tumor necrosis factor alpha did not impair cytotoxic activity of alveolar macrophage against lung cancer. All in all, alveolar macrophage in lung cancer patients shown to be function normally, and the secretion of TNF-alpha by alveolar macrophage appears to have an important anti-tumor role. Next, let we move to macrophage activating agents. Macrophage activating agents play a crucial role in the immune response by stimulating macrophages, which are a type of white blood cell that plays a key role in the body's defense against infections. Based on the diagram below shows the pathway of macrophage activating agents. Tumor cells can be linked to interferon gamma and granulocyte macrophage colony-stimulating factor through their interactions with the immune system. Tumor cells activate the interferon gamma and granulocyte macrophage colony-stimulating factor agents, which means tumor cells can stimulate the production and release of these immune system molecules, which can then attack and destroy the tumor cells. By activating the interferon gamma and granulocyte macrophage colony-stimulating factor, it triggers an increase of tumor necrosis factor alpha and interleukin-1. Next, interferon gamma is a type of cytokine, which is a protein that helps regulate the immune system produced by various immune cells, including T cells and natural killer cells. Interferon gamma plays a key role in activating macrophages, a type of immune cell that helps fight off infections. IFNG plays a critical role in the immune response against tumor cells. In anti-proliferative effects, interferon gamma can inhibit the proliferation of tumor cells by inducing cell cycle arrest and promoting apoptosis. In immunomodulatory effects, interferon gamma boosts the immune response against tumors by activating macrophages, increasing antigen presentation, and enhancing MHC molecule expression on tumor cells. Anti-angiogenic effects. Give effect on that interferon gamma can inhibit the formation of new blood vessels, angiogenesis, that are necessary for tumor growth and metastasis. Lastly, immunoregulatory effects. Interferon gamma regulates the tumor microenvironment, affecting the balance between pro-inflammatory and immunosuppressive factors that could impact tumor growth. Interferon gamma roles of alveolar macrophages in tumor regression. Interferon gamma activated protein, IP10, an anti-tumor molecule that impairs tumor angiogenesis, whereas granulocyte macrophage colony-stimulating factor promotes proliferation of hematopoietic progenitor cells and influences the anti-tumor function of alveolar macrophage. After interferon gamma stimulation, the cytotoxic effects of alveolar macrophages in lung cancer patients improved in certain aspects of lung cancer patients' condition. Stimulation with granulocyte macrophage colony-stimulating factor enhanced expression of mRNA coding of tumor necrosis. Factor alpha, interleukin-1, and interleukin-6 in alveolar macrophages and monocytes from patients with lung cancer. in a time-dependent manner, an isolation of alveolar macrophages from patients with lung cancer receiving granulocyte macrophage colony-stimulating factor therapy and cultured with LPS showed enhanced interleukin-6 secretion.
Function of GM-CSF. With IFN-gamma, it helps to recruit T cells to the site of inflammation or infection. It enables the migration of T cells to areas where their activity is needed, such as in response to viral infections, autoimmune diseases, or cancer. It encourages the growth of blood cell precursors and influences the anti-tumor function of AMs. This means that GM-CSF can support the development of immune cells and enhance their ability to fight against tumors. By promoting the proliferation and activation of immune cells, GM-CSF can contribute to the body's natural defense against cancer. Enhanced expression, TNF-A, IL-1, and IL-6 in AMs and monocytes from patients with lung cancer.
There was a study that shown that tumor growth caused by tobacco smoke was mediated by IL-6. Hence, a deficiency of IL-6 leads to decreased lung tumor cell proliferation. Other than that, there is another study suggested that targeting IL-6 could potentially improve lung cancer therapeutic techniques. This can be done by blocking interleukin-6. Why blocking interleukin-6? Elevated interleukin-6 level linked to cancer growth and poor prognosis. Thus, targeting blocking IL-6 will inhibit growth of cancer cells. Not only that, this method also can suppress angiogenesis, invasiveness, and malignancy of several cancers. In addition, there was other clinical study demonstrated that non-small cell lung cancer NSCLC patients with high plasma levels of interleukin-6 responded poorly to chemotherapy. This study suggested that interleukin-6 could be used as a prognostic marker for lung cancer survival among those patients who have received chemotherapy. TNF-alpha, interleukin-6, and interleukin-1 does exist in a healthy individual in a normal level. But in certain situations, such as during an infection or inflammatory response, the levels of these cytokines may increase temporarily as part of the body's natural defense mechanisms. Imbalance or overproduction of these cytokines might contribute to inflammatory disorders and diseases, which will also link to tumor progression.